issue that no woman wants to admit they have: unwanted hair. So if you're tired of shaving, waxing, and plucking, you may be tempted to try a more cutting-edge approach. There are now new devices in laser hair removal that allow every skin tone to potentially get it. But is laser hair removal safe? Lauren's here to have that conversation with us. So what have you tried in the past to get rid of unwanted hair? Everything
from shaving, from waxing, from threading, tweezing, anything.
So why are you here today to think about getting it done with a laser?
Just tired of spending time trying everything and just want to make it easier and pain-free and just be on my way every day.
And no concerns about that big machine over there blasting lasers at you?
No, not at all.
Not at all. Well, we're going to see if you're right. Dr. Doris Day is a leading dermatologist. She's been performing laser hair removal on patients for the last 10 years. So how's it different from waxing and shaving and threading and all the other crazy things that women often do?
Well, here's the deal, Dr. Oz. Women, there are parts of the body we just don't want hair to grow. And we spend so much time. It's really a project between shaving and waxing and all the things that we do. And every day in my office, I see the consequences of that. I see ingrown hairs from waxing, razor bumps from shaving. And with the old lasers, they were small spot sizes. We had to put gel on. It took like an hour and a half to do a leg. And it was really painful. The newer technology has come a very long way. We can really control the energy. They're much bigger spot sizes that pulls the hair in, knocks it out, and it's virtually painless. So it's really come a very long way.
We'll see if it's painless in a moment, but let me explain to everybody exactly how this act works when you're trying to get rid of unwanted hair. So I made you a model of what the skin looks like. So let's go in and look, for example, at lower leg hair that so many women want to get rid of. If you look at the skin, you'll notice that beneath the hair, there are the follicles. When you laser, the laser goes through the skin and heats up the shaft and actually irritates it and sometimes damages irreversibly at the right energy level the bulbs down there. So with the shaft now absorbing the laser energy and the skin not irritated, you'll begin to slough off the hair. And after several cycles of treatment, the hair may no longer be able to grow, making shaving a thing of the past. So, Lauren, after you shave, how long does it take typically for you to be able to feel the stubble?
Sometimes a day, sometimes 2 days, some days it's just hours and it's back.
All right. So let me show you, that little model here, what we think is going on with the laser. But, Dr. Day, if someone were to have laser therapy rather than shaving, does it ever grow back the hair?
Well, the FDA says permanence is 2 years. But in my experience, having done this for 10 years, I can tell you it's a lot longer than 2 years. And even when some of the hair does grow back, it's much finer and much easier to deal with just a touch-up or even just shaving at that point.
All right, so, you ready?
Sure,
I'm going to show you
go for
what's
it.
Happening. And we're going to also address the concern about burning. So when you put the laser on, it doesn't touch the skin. It touches literally just where the pigment is. So only the areas that are, in this case, dark, because that's the kind of laser we've picked, will absorb it, and the skin is not impacted. The hair is sort of knocked out, and that damaged hair will fall out. So it disappears. And you just do this again. You don't have to do it hair by hair, obviously, as Dr. Day mentioned. You can do large areas at once. But you slowly take out these hairs, and we can have them slough off because now they're damaged irreversibly. So, Dr. Day, is this a pretty accurate reflection?
Well, this is a great reflection, but there's a couple of points. One, it shows how when you shave and even when you wax, you're really dealing with the very superficial surface of the skin. When you're treating with the laser, you're going all the way through the skin. You're not targeting the surface or even the surface hair. It goes right down to the root of the follicle where the pigment is. And that's what we're knocking out. By killing that, you're killing the hair. The hair will not grow back. And every time you do it, you get more permanence. Plus, you're doing one hair at a time. With the laser, I'll do this whole section in one shot, and that'll get rid of it. But also, you need to shave before you do the laser treatment, because you showed so perfectly how when you heat up the hair, it lands on the skin. That will burn the skin. You need to shave so the hair is present but short, and then you'll have great results.
And the skin tone issue has been a big one for a lot of women. Do the new lasers really make it possible for most skin tones to have this done?
Absolutely. With the new lasers, we can control the energy level. And with this one I'm going to show you, it pulls the hair up so it's closer to the source. And with less energy, I can target more hair of more different skin tones safely with great results.
What parts of the body does it work best for?
So my favorite places, most rewarding, are the underarms, bikini, lower legs. The coarser the hair and the darker the hair, the better it works in fewer treatments. So it's great in all areas, but those are the best areas.
What about the face?
The face, you have to be a little bit more careful. That's hormonally driven. And if you have coarse hair growing on your face, you might have a hormonal imbalance. You need to see your doctor to make sure you don't have polycystic ovarian syndrome or some other hormonal issue, because you don't want to treat and mask it and get rid of the hair, not knowing what you're dealing with when that could be serious. And oftentimes that's an area that the doctor should treat themselves because there are some greater risks in that area. But it can be done very well in that area too.
Lauren, moment of truth. What part of your body would you like to treat?
I'd love to get rid of the hair on my underarms.
May I see it?
Sure.
Oh, so you shaved.
Yes.
Don't mind show it to
Yes,
camera.
I did
I
everything
prepped, right?
It is. You
And
did it
Lauren
right.
I don't want to burn
perfect.
any hair.
Hop over here.
There we go.
Everyone in the crew, if you can put on your goggles. There you are, Lauren.
Here you go, Dr. Oz. Here you go, Lauren.
Are we all ready? The audience does not have to put goggles on, I'm told. This laser is going to be very quickly applied.
All right, arm up. You can lean back if you like.
Okay.
You comfortable?
Sure.
Well, don't close your eyes because you'll miss it. You
Okay.
can close your eyes if you like, but everyone else, don't close it because you'll miss it. It's just pulling the hair up, and that's it.
That's it?
Didn't hurt at all.
Are you serious?
Yep.
I don't smell any burning. There's nothing.
Nope. Nothing.
I
And
expect
one
the charred
more.
skin here. Why are we not even
And
smelling?
you hear the click of it. You can see minimal redness, but 3 shots, her whole underarm is done. That's the end of it.
You've got to be joking.
Didn't hurt at all.
I know. It's that good, that easy, and that fast.
But not all the hair fell out, so.
It won't. It'll come out over the next few days. So as she shaves, she can go forward, just get on with her life, and the hair will just be gone, and it just won't come back.
And how many times does she have to have the therapy administered?
Anywhere from 4 to 8 times, ideally at 1-month intervals. We go with the hair growth cycle. So underarms probably at a month. If the hair grows back slower, you can go at 6 or 8 weeks. But you do have to be regular about the treatments to get the best results.
And give me an idea on cost.
It can be anywhere from $75 and up. The great thing is it's really the time that costs money besides the laser. And because it's so fast, we can bring the cost down because we can see more patients. And so that makes it almost less expensive than waxing.
I don't know if you've seen these, but there are lots of products being sold over the web. The spas do this now. So why should someone come to you versus having it done there?
You need to have someone who knows the skin, knows technology, can help determine what the best settings are for you, and then you can enjoy the results and have lasting results with minimal to no risk.
I love the fact that it works so well. Congratulations.
Thank
Thank you
you.
very much.
Thank
We'll be
you.
right back.